Sebaceous filaments, treatments and causes. Beneath the skin's surface lie tiny glands that create sebum, an oily substance that helps lubricate the skin. Sebaceous filaments are structures that allow sebum to flow to the surface of the skin. When the body overproduces sebum, the sebaceous filaments can fill up. They may become visible and resemble very enlarged pores. People often confuse sebaceous filaments with blackheads. Blackheads are a form of acne. Sebaceous filaments are not a type of acne, they are normal structures within the skin. However, the overproduction of sebum that causes sebaceous filaments to fill up and become noticeable can also cause whiteheads or blackheads. In this article, we look at how sebaceous filaments become visible. We also describe the differences between sebaceous filaments and blackheads, treatments for each, and when it might be a good idea to consult a doctor. Pictures. Differences from blackheads. When sebaceous filaments are noticeable, they can look like enlarged, darkened pores. A person might easily confuse them for blackheads. The key differences between blackheads and sebaceous filaments involve their structure. A blackhead is a blockage or plug at the top of a pore. The plug prevents oil from escaping through the pore. A sebaceous filament is a thin, hair-like structure that lines the inside of the pore and helps sebum travel to the skin surface. It has no plug. Appearance and color. A noticeable sebaceous filament may look like a dark dot on the skin. The dot may resemble the head of a pin, and it may be yellow, gray, or clear. A blackhead is a very dark plug at the top of a pore. The dark color develops when the plug is oxidized through contact with the air. Extraction. If a person squeezes or extracts a sebaceous filament, a white or yellow worm-like structure may ooze out. Or the filament may not produce anything. Trying to extract sebaceous filaments can injure the skin and cause scarring. It can also damage and stretch the pore, making it appear bigger. When a person extracts a blackhead, the dark plug may come off. Beneath it, there may be white or yellow sebum and skin cells. The American Academy of Dermatology advise against squeezing or popping acne of any kind. Causes. The skin's normal process of producing sebum can cause sebaceous filaments to become noticeable. This is more likely to occur in people with more oily skin or larger pores, compared with people who have drier skin and smaller pores. Age. Genetics. Having thicker hair follicles. Sun exposure. Visible sebaceous filaments are not a sign that the skin is dirty. Treatments. Controlling the amount of oil on the skin and using exfoliating skin care products can help keep the pores clear. This may minimize the appearance of sebaceous filaments. Use gentle products that cleanse the skin to prevent overdrying and irritation. The best product will depend on the person's skin type. No skin care product can completely get rid of noticeable sebaceous filaments. However, the following ingredients and approaches can help reduce their appearance. Salicylic acid, also known as beta-hydroxy acid, is an ingredient in many facial cleansers and acne creams. These products may contain 0.5% to 2.0% salicylic acid.